joining us now who's done some research on this, Michael New. He's a professor at University of Michigan in Dearborn, Michigan. Hello, Michael.
How you doing, Mark? Good to be here.
Well, thank you for joining us. You're an old long-time war dog in the pro-life battles, and we appreciate what you've done in the past. And you've done some research on this issue.
Yep.
When we say that Obamacare pays for elective abortions, is that true or not true?
It is absolutely true.
Right. Tell us how you know this.
All right. Obamacare pays for abortion in two different ways. There's two separate funding streams it sets up. First is that it subsidizes Medicaid expansion in the states. In many states, low-income earners are able to get health care coverage through Medicaid, and people can decide whether this expansion is a good idea or a bad idea. But the problem that pro-lifers have with it is that in 17 states, abortion is publicly funded through the Medicaid program. In most of these states, courts have ruled that low-income women who are on Medicaid, that the Medicaid program is required to pay for their abortion services. So again, by expanding Medicaid throughout the state, subsidizing the expansion of Medicaid, that's going to mean that more women are going to have their abortion covered, and that's going to mean more abortions. Secondly, as is well known, Obamacare creates these state health insurance exchanges. We've seen the rollout this week, and what's got most of the attention is that the website has been pretty buggy, and the people who'd like to purchase insurance through these exchanges very often have not been able to do so. But again, to help low-income earners buy health insurance, taxpayer dollars are subsidizing some of these insurance programs through the exchanges. And the problem, again, is that some of these health insurance programs that are subsidized by our taxpayer dollars fund abortion. So again, you have these exchange plans, they're subsidized by our taxpayer dollars, and they cover abortion. So you have the expansion of Medicaid, which results in more public funding for abortion, and you have these subsidized exchange plans that fund abortion. And I'm part of a think tank in Washington, D.C., the Charlotte Lozier Institute. That's the research and education arm of the Susan B. Anthony list, and their analysts have done some research and have concluded that roughly there will be, because of Obamacare, over 100,000 more publicly funded abortions every year. So the exact number is about 115,000 more abortions every year funded by taxpayer dollars because of Obamacare. So it's very clearly there are two separate funding streams. They're going to result in more taxpayer dollars funding abortion, and sadly that's going to result in more abortions.
Michael, correct me if I'm wrong, but isn't there a third funding stream? Health and Human Services Secretary Kathleen Sebelius has mandated that these exchanges have a minimum of a $1 a month surcharge to pay just for abortion. There's not a surcharge for leukemia or heart disease or cancer or something like that, but a $1 surcharge, a minimum $1 surcharge for abortion. How does that work?
Well, essentially, that you're right, Troy. That's another funding stream. I mean, they're trying to make it appear as if that abortion is elective, and those who don't want a plan that covers abortion can opt out. But by and large, money's fungible, and it's just yet another funding stream that's going to be putting more federal dollars into the pot that's going to be subsidizing abortions for women who are seeking them. So you are right. That is another funding stream.
Well, I would argue that, let's say you're in one of the exchanges and you've picked a insurance carrier who does not, that company does not fund abortions. But let's just say that a woman who was elected for that one becomes pregnant and wants that organization to pay for abortions, and they say, well, no, we don't, you chose us and we don't pay for abortions. Because it prohibits discrimination against somebody for pre-existing conditions, she could just drop that insurance company and pick up another one, and instantly they've got to pay for her abortion, right?
I'm pretty sure that's the way it would probably work. Obviously, the details are being fleshed out. Here's another situation that that's not getting much attention. Sometimes it's not clear which of these plans cover abortion and which ones don't. Again, the think tank I work with, Charlotte Lozier Institute, is doing research on the state plans offered to the exchange. They're making phone calls, and very often the people at the other end of the line don't know if these plans cover abortion or not. Or in some cases, they'll hear conflicting things about the same plan. So again, there's a lot of misinformation. I think, again, even the insurance carriers themselves seem pretty confused about whether or not abortion's covered or not. So again, I think it is really clear that, you know, there are funding streams out there. They're going to subsidize abortion, and the sad result is going to be there's going to be more abortions as a result of Obamacare.
And you see what's going on here. Those that are radically promoting abortion through the channels of our government, they don't care if people are confused or not. They don't care.
Right.
Yeah, they don't care about. It's not the effort to make people understand. It's the effort to get money into the abortion industry. So if they say, listen, the best way to do this is to make this whole law, first of all, and then all these details, Michael, that you're talking about, the whole purpose is let's make this so confusing that we get that money. As long as we get that money flowing in there, you know, that's all that counts to them.
Well, you know, it's kind of like, you remember in one of the most idiotic statements I've ever heard an adult say in my entire life, Nancy Pelosi saying, we got to pass Obamacare before we can find out what's in it. Remember that? I mean,
Right.
This is the most astonishing statement I've ever heard an adult make in my entire life. It appears now that even once you pass it, you're not going to know it.
No, that's right.
I'm sorry?
There's a lot of truth to that. That's correct.
If this is true or dream. Deep down inside, I feel the scream. This terrible silence.
The law itself built in these risk protections for insurers for the first 3 years. And that's what all those fees that they're collecting go to fund. So some insurers, if they lose money because they end up with a lot of high-cost patients, would get some sort of rebate. We're not sure what's going to happen this year in 2014. It's way too early. But the fact that we've seen more people actually on the exchanges means that there's more going into that fund. What the administration clarified last week was that if those funds end up short, especially next year in 2015, that they'll make up the difference to make sure those protections are there to keep insurers on the exchanges.
Okay, so Avik, what's your thought about all of this?
Yeah, Mandy, so the key thing is that premiums on the exchanges went up 41% but relative to 2013 rates because of all the regulatory changes in the law. And insurers were saying that they were going to have to increase rates even more next year because of all the changes that the White House made, like the grandfathering changes and some of the other improvisations. And so the administration effectively had to do to put out these about $3-4 billion in these risk corridors to ensure that insurers wouldn't raise their premiums even more in 2015, because you'd find out about that this summer, this fall, going to elections. They didn't want to do that.
In other words, the president is just worried about the political backlash with all of this, right?
There's a lot of concern about that, and there's also concern about the legality of this move, because a Congressional Research Service report stated, that's the in-house think tank of Congress, stated that the White House doesn't have the authority to move these billions of dollars around without an official congressional appropriation.
Yeah, okay, bro. I was going to say there's no certainty we will need this taxpayer bailout, right? If the premiums, you know, can stay kind of calm and they don't lose a bunch of money, but it does sound like a bailout.
Well, it's built into the program is the thing. The majority of it was already built in, funded by taxes. One of the things that insurers have done at this point is they haven't built this into their annual estimates because it's a backward-looking thing. They won't know whether they'll get it until next year. So a lot of analysts have been asking them all along, is this part of your earnings estimate for this year? And so far, they haven't calculated it yet because it's just too early to know.
Sounds to me like another instance of privatizing profits and socializing losses, right? I mean, how many of our viewers who might run their own small business are thinking, well, damn it, if I lost money, I'd sure like someone to backstop me.
That's been the political concern, and the argument you'll hear from the White House is, well, we need to give them that sweetener, that subsidy, that extra shake, because otherwise they won't participate in the exchanges, and people won't be able to find coverage.
It is only for the first 3 years. After that, they're on their own.
That's right, and actually that's why the Congressional Budget Office anticipates that in 2017 to 2018, when this program goes away, you are going to see a spike in premiums at that point because these subsidies won't be there to cushion the blow.
It's a new, exciting online video contest. So we've got $30,000 in prizes.
What's hated by unions has businesses wary and dropping some coverage like the skin secondary, causing thousands of layoffs, taking its toll. What's so good for people that they're forced to enroll? What's a law that's so good folks who passed and defended it see it and got waivers to be exempted? It's like Olestra at first, it sounded hip, but we quickly found ourselves dealing with a whole lot of OBAMACARE, OBAMACARE. Unions and businesses both in despair. So to recap, young people, your hours get cut and your income goes down and your premiums up, and the taxes you pay with the cash you have left go to pay for a stupid video contest touting Obamacare, Obamacare. Unions and businesses both in despair. It's hated by doctors and unions are mad. Not since Billy Ray Cyrus has someone made something this bad.